Well, welcome back. We've been actually discussing on how you actually know that somebody has hyperthyroidism, the signs, the symptoms, and then we looked at the first one, which we said hyperactivity of your metabolic rates because of your hyperactivation of the sodium and the potassium pump. And so now we are going to look at another obvious sign. And the next one is your cardiovascular dysfunction. Your cardiovascular dysfunction actually brings about dysfunction or hyperactivity in your heart rate. The heart rate increases, contractility increases of your muscles, the cardiac cells increases. And this is because there is an effect on your beta-1 receptors. Your beta-1 receptor is actually very sensitive, and this affects the epinephrine and norepinephrine neurons. So there is hyperactivity of your heart rate, your blood pressure, the systolic blood pressure also increases, which controls your vasodilation and vasoconstriction. Also, the liver also tends to produce more thyro-binding globulin. Your liver tends to produce more of that. And so when there is excess production of tyrosine-binding globulin by the liver, excess tyrosine binding globulin actually causes estrogen to be soaked up, progesterone is soaked up, testosterone is soaked up. And so there is reduced level of these three hormones. Thereby, it leads to irregularity of your menstrual cycle. So we can see that abnormality in your thyroid hormones doesn't just affect thyroid gland, it affects so many things. As we have seen, tyrosine binding globulin actually, because there's increased level of tyrosine binding globulin, it actually causes reduction of your estrogen, progesterone, and testosterone. So when there's abnormality in your thyroid hormones, this actually affects infertility and libido. Gastrointestinal disorders is being affected too, because there is increased metabolic rate, and so there will be increased smooth muscle motility. In the GIT, the smooth muscle will be increased motility. And so the intestinal fluid moves so quickly. Digestion is poor because there is diarrhea. Several of these actually happens, and the biggest one is what we have called the thyroid storm, due to the combination of increased stress, chronic thyroid hormones level, because there is so much increase in your sympathetic nervous system. There's so much increase in your sympathetic nervous system. All this with massive activation of your ATP, all this causes severe agitation, severe heart contraction, severe pressure on the blood. And so there's a drop in your systemic vasoresistance. This can actually be massive, and this is called thyroid storm. So we have seen that hyperthyroidism causes a lot. It actually brings about a lot